Good morning and welcome to the Haven Financial Group radio show. I'm Larry Kallevig, founder and CEO of the Haven Financial Group. We appreciate you listening this morning. On with us today, we got Glenn Ramey, our insurance specialist at Haven Financial Group, all the different types of retirement and the insurance that goes with it. So it's good to have Glenn on with us this week, Kim, and a lot to talk about. Summer, and the summer's, it's going by really too fast, isn't it?
I can't even think about it. It's just happening so quickly. So here we are. This is the first weekend in August. Goodness gracious. I'm always so disappointed because people say, oh, well, it's August, so summer's over. And I'm like, no, don't say that.
Right.
Please don't say that. Right. We got a little time left. We got a great show today. We're going to talk about having a healthy retirement. And we mean that both in a physical healthy way and certainly in a financially healthy way. We're going to get started talking about accounting for healthcare costs, something that we talk about a lot here, but that we can't stress enough, the importance of accounting for healthcare costs as you prepare yourself for retirement. Saving money while saving health and staying healthy. We're also going to talk about recalibrating your lifestyle in retirement. And then we'll wind the show up a little bit later in the second half with stable finances, happiness, and health in retirement. And as you said, Glenn Ramey is with us. Always a delight to have Glenn here.
Thank you.
So let's get started. I think, Larry, one of the most important things that I know you say constantly in retirement or as you prepare for retirement is understanding the expense and what it's going to take to make sure that your health care is up to snuff.
It is. Every week, I think I say it, that healthcare is underestimated, and Glenn will talk more about that, why we should prepare for it. And it is a big cost. It's a big budget item in retirement. We factored into our planning, our process, just to account for it because it's going to be there. We're all going to have to look at Medicare at some age, and it's not getting cheaper. In fact, the rate of inflation on that's far, far higher than the regular inflation. So it's real. Let's talk about it.
Absolutely. You know, Larry, a lot of people who are listening to us right now are probably still in their working phase of life, and maybe they are covered by an employer or at least are involved in an employer's plan. So maybe they're not thinking so much about this. Before we get to Glenn and start to talk a little bit about, the accounting of healthcare costs, is staying on an employer's plan, is that a smart thing to do if in fact you can do it?
Oftentimes, it is a smart idea. Glenn, why don't you chime in on this because this is your wheelhouse, and I want to utilize you to the best of our ability here today because you have years of experience and insight with this. Could you shed light on that, please?
Well, thank you, Larry. Absolutely, I can. I would agree with Larry that oftentimes the employer-based insurance is ideal to stay with while we're in it. It's a tax-free expense taken out of people's paychecks before taxes are calculated, which means we get to stay in lower tax brackets, keep more of our income. On top of that, employers typically contribute to the cost, so we're getting a cost break on the cost of that insurance because the employer is helping pay for it. And when it comes to that Medicare topic, one thing that I think is often misunderstood in Medicare is the ability to delay Medicare based on having employer health insurance in place. Mm-hmm. So a rule that everybody should know is that if my employer is considered large by Medicare, 20 or more full-time employees, and they offer benefits that are as good or better than Medicare called credible health care. So if my employer plan is credible and I'm with a large employer, I actually have the right to delay my Medicare as long as I'm working or my spouse is working for that health care coverage.
Terrific. So now let's say it is time to get on Medicare. One of the, I think the maybe myths about Medicare is it doesn't cost me anything, that I've already paid through all of my taxes through the years. And that's certainly not the case, is it, Glenn?
Not at all. There are some components that are cost-free, and that's the Part A benefit. That is the one you've been paying for. And if I can put Part A in the simplest terms, it's our inpatient benefits of Medicare and home health care and hospice care covered by Part A of Medicare. But that Part B benefit that you're going to need to get is something that does have a monthly cost to it. Today, that national cost is $202.90 per month per person on that insurance policy. And that Part B benefit is going to be our outpatient medical coverage, our doctor appointments, our diagnostic testing, our, again, outpatient surgical procedures, all those kind of things, durable medical equipment, all fall to that Part B benefit of Medicare. And then
And
on
is-
top of that, yeah, go ahead.
I was just going to say, and Part B, is that required?
It is required if you want any of the other insurances that go along with Medicare. In
Okay.
addition to that, there are penalties for not having Part B of Medicare in place when you are either 65 and do not have group coverage in place that would allow you to delay that Part B benefit if you so choose to have it. So no, if you're going to do a Medicare Advantage plan or a Medigap or Medicare Supplement plan, Part B is going to be a requirement of that. And again, for every year you delay taking Part B, there's a 10% penalty for not having it in place if you lack that other credible healthcare coverage coming from a job.
Okay. Let's talk a little bit about some of those gap plans that you're talking about, supplements and gap plans. Explain what those are.
Yeah. So I'd say people usually have two paths they can go down for Medicare. They can go down what's called the traditional path, which is using Part A and Part B of Medicare as our primary medical coverage, and often coupling that with a Medicare supplement or Medigap insurance policy. Those terms mean the same thing, by the way. And then a standalone prescription drug plan for a complete portfolio of benefits. If you don't go down that path, you're typically going down the Part C path or the Medicare Advantage path, where you're buying a Medicare Advantage plan that doesn't replace your Medicare, but steps in front of it. And Medicare goes into the background while the insurance company and their plan are what you use for your healthcare benefits, which are often either option, I say, is an improvement to Medicare. And there's reasons why you're going to do one of those two options. And it's not just because someone wants to sell you more insurance. Part A of Medicare, I tell people, is a limited benefit health plan, meaning, as an example, it only covers a maximum of 150 consecutive days in a hospital. On the 151st day, Medicare would stop paying that medical bill for you. And 60 of those 150 days you only get to use once in your lifetime, right? So I say there's gaps in the hospitalization coverage of Medicare. And then both Part A and Part B of Medicare have no out-of-pocket cap to their benefits. Unlike your employer plans, unlike your insurance policies prior to 65 you're buying on your own, Medicare doesn't have by itself an out-of-pocket limit. So we look to these Medicare Advantage, Medicare Supplement plans to fix both those problems.
Mm-hmm. So what are we talking about out-of-pocket expense when we talk about those gap or supplement policies?
Yeah, so let's use Part B as an example, simple one to give you a description for. So Part B has a small deductible today of $283. Once you reach that deductible, Medicare Part B would start paying 80% of the medical bills for you. You'd be responsible for 20%. But Medicare doesn't have a stopping point per calendar year for that 20%. So if I'm going through chemo radiation treatments and I'm going through $10,000 a session treatments, which are all outpatient, by the way, you would owe $2,000 per session. And you could be 5 sessions in, $10,000 deep in medical bills with Medicare, and Medicare is not done telling you need to pay that 20%. So we look to these other plans like Advantage or Supplement plans to place a limit on how much we could owe in one calendar year before our insurance starts to pay 100% of those medical bills for us.
Okay. All right. And so now I go shopping for a supplemental plan. What kind of money am I spending there?
So depending on options you might take in Medicare, pricing on the Advantage side could start at $0 in Minnesota and go up to about $200 a month. Medicare Supplement plans might range anywhere from $55 to $380, almost $400 per month, depending on which plan we're talking about. And standalone drug plans could be anywhere from $5 to $140 per month in the state of Minnesota. So we're talking somewhere between $200 a month just for the base cost of Part B at the least expensive thing I could do, or up to over $600 per month on the Cadillac version of Medicare policies that could be available to you. So not an insignificant monthly cost that people are coming into that they're not expecting leaving their employer plans.
So, Glenn, this is why I ask you that question, because it kind of circles us back to the beginning where we said, this is a cost that everybody needs to be aware of. This is a very confusing situation, by the way, I think for a lot of people. There's a lot of rules and ins and outs. And, for those who don't maybe know this, you can reshop those supplemental plans once a year. I mean, there's just lots of changes all the time. But what I think we really want to stress to those who are listening today is the importance of being aware that there is a cost associated with this, and this is something that you have to plan for.
Yeah, start speaking with someone soon, right? So that you understand what you're walking into in retirement. I tell people all the time, I don't blame you for not knowing this stuff. I don't blame you for feeling confused and overwhelmed by the Medicare system, because we've had that employer insurance base in our place the whole time, typically. And they don't give us a lot of options to pick from. And since they're paying for it, we're often going to take that coverage because we can't get it cheaper anywhere else. And now that we're on our own with Medicare, we might have a half a dozen different insurance companies trying to sell us insurance policies with 50 different medical plans you could be picking from necessarily to decide what is in my best interest, what's best for me. And that's why the best advice I'll give is look to the help of an individual that does this, right? A professional that will give you a non-biased opinion. Be careful with them. You still got to be careful as always, but make sure they offer all the companies and all the plans and spend time with you, sitting down, educating you on these things before they're trying to pitch any insurance company or policy to you.
Kim, if I could add to that as we close out this first segment, takeaway on this Medicare discussion, which it's overwhelming and it changes, and have a partner that you can lean on to explain things, that will spend time with you. If you're listening today and you're getting close to retirement, 3 months prior to retirement, you should be looking at Medicare if you're at that age. If you're bridging the gap, whatever that looks like, or maybe you actually are already on Medicare. Annual enrollment is coming up October 15th through December 7th. Get on Glenn's calendar, at Isabella's calendar. We are able to help many, many, many people in the Medicare discussion, making sure you're on the right plan, not because we change every year just for the sake of change, but if there's something better that fits you, that's more cost effective, I'm sure you want to know that. Let us be an asset or a resource to help you with this Medicare discussion.
Absolutely. 612-504-8400. That's how you reach the folks there at Haven Financial Group to talk about all things retirement. But certainly if you have questions about your healthcare coverage in retirement, you just heard Glenn, and he's going to stay with us here to continue this conversation, but you heard him explaining some of it. And I think, as Larry just said, this can be very overwhelming. 612-504-8400 is the number. When we come back, Glenn, let's talk a little more about HSAs. Let's talk about long-term health care. There's some other things that we haven't had a chance to hit, and let's be sure we do that. This is the Haven Financial Group Radio Show.